Thank you for your comments and your diligence, Bertha. Your perspective reaffirms commitment to keep our focus on what works for the person. Your sharing is most appreciated. My name is Samantha Fell. I'm Director of Clinical Integration and Quality Improvement at Spectrum Health Lakeland. And in the words of Bertha, we do have a challenge to provide a vision of hope, giving, and peace to a level of greatness beyond the rhetoric. It's been a tremendous morning of data presentations and impassioned speakers about how we together can provide that transformational community of care. And I'm here to describe some of the next steps that we'll be taking over the next 2 years. And just so that you're aware, the implementation grant starts tomorrow. Today's our last day, and tomorrow is the beginning of our implementation grant. And I just wanted to really briefly review a few of the things that we've learned over the morning. As a community, we are an aging population with high levels of care needs, and our greatest need is in the area of home and community-based services. As a community of caregivers, those who provide the personal care for your loved ones, we know that you too are an aging population, and that providing care does in fact take up a majority of your time. Balancing those responsibilities with the overall cost of care is quite a difficult challenge. And together we need a coordinated effort as a community to help address those concerns. And as a community of clinicians and agencies involved in providing the support, we have recognized the level of complex needs of those patients, both clinically and socially. And we understand and struggle as a community ourselves to ensure that we are clinically connected in those plans of care. We have silos, and we need to work closer together. We have to understand and do understand the need to support not only the patients, but that holistic view of the families and their caregivers as well. Some of the recommendations that you heard this morning are around developing those team-based collaborative plans of care across the entire community of resources, and that's quite a challenge, and we're up to that challenge. Providing access to the patient records not only for those engaged clinically, but also throughout the rest of the team and, again, those patients and families. We need to have that collaborative understanding of what we can do to be helping these complex patients. Provide better access to technology. We saw the information around what we can be doing, again, as a community, provide some more technical assistance and removing some of that reliability on the in-person healthcare that we need. We need to continue to work with local and state governments to advocate for our aging populations in the areas of financial and social support. And so, as I mentioned, tomorrow is day one for our implementation grant, and we have a few phases that we are going to be working through over the next couple of years. That first phase, we want to be looking and asking you for assistance. So as you've heard, we have a lot of information. We have a lot of great recommendations and plans and ideas. We really do need to hear from you. We really want you engaged. And so the first few months, we're going to be holding some action groups, taking all those excellent recommendations and working with you to create that intervention. Creating that plan of care, that group together. What does that look like? And so we want to spend the next 3 months doing that. Once we get that intervention together, our first phase is going to be looking at particularly complex patients, those who we consider high ED utilizers. People are visiting the emergency department more so than others. Medicare, Medicaid, high complexity scores. Those are the initial group of patients that we're going to look at. We're going to work with those patients, their families, caregivers, and their primary care offices and their care teams within those offices to present this intervention as an opportunity and a program. We're going to be engaging about 20 to 30 patients during that 6 months. And as we do this work, we're going to be looking and gathering data and adapting and adopting a few things and learning from the patient, learning around the interventions. What do we need to be doing to adapt that intervention to make it more sustainable? After that, the initial 6 months, we move into phase 2, and that's where we're really looking at that transitional perspective. So we're going to be going and working from an inpatient perspective, identifying those patients that are at risk of readmissions, that have a higher complexity from a transitions perspective, and offering this program as a destination. So providing this program from a transitional perspective, working with those patients. Again, we expect to get another 20 to 30 patients to help inform the intervention and adapt it a little bit more as we move along. And then finally, in phase 3, going back to that high ED utilizer patient list and looking for those patients who in fact don't have a medical home, that are lacking a PCP. What we do hope to be able to do for those initial months is create a destination of care, a primary care office that in fact is going to be addressing those complex needs and again, engaging heavily from a community of care perspective and having that destination there and using, we hope, another 20 to 30 patients with those. But we can't do this without first starting with you, and so we need your help. We need your engagement in that initial first 3 months. And I'm going to turn this back over to Lynn. Thank you so much, and we hope to hear from you.
What a morning. Can you feel the excitement of conjoining trends? The medical community leaning to the community-based clinicians leaning to their medical partners, together tackling some of the most complex issues there are, while recognizing person-centeredness and interdependence as core values. Enthusiasm only builds. As Sam stated, the implementation grant begins tomorrow. We'll be taking all that we've learned forward. Like-minded people build energy off each other. I am so grateful for the colleagues that are part of this team and for the people we hear on the phone. We all build energy here on the phone, here through our virtual platform. We welcome them all as in partnership because together we build our energy. We off each other. I have often said like-minded colleagues are mental health for our good work and the path ahead. These are issues of life just about everybody can relate to. As an attendee, you'll be sent a link to provide feedback on today's event. As part of that feedback, we'll ask you to let us know if you're interested in staying involved and receiving more information. We hope you are. And as our gift to you, we'll provide a book for each person registered today. Actually, there'll be a choice of books, and one of the books that Robin Golden flashed on the screen, Medicare and Communities, will be one of those choices. Take a look, and be sure to complete the book order form emailed to you that comes with the evaluation form. Little incentive there. I'd like to thank all the speakers today and all of you for taking the time to convene with us. Thanks also to the Mendel Center and LMC for their behind-the-scenes support. Recordings of this event will be fully available in about a week or so. Thanks for your time today. We're glad you came. Have a good day.